Thank you very much, Mr. Bangole, for your moderation. I also wish to acknowledge guests in our midst. Thank you, everyone. I'm not going to be able to mention everyone by name. Our next speaker is going to be Dr. John Mangwiro, who is the Deputy Minister of Health and Childcare in Zimbabwe. Over to you, sir.
Yeah, thank you, Dr. Mgumbate, once more, and everyone, good morning. I want to say I recognize the presence of the President, the Vice Presidents, Northeast, Southwest, and Central Africa regions, the representative of ECOWAS, the Ministers and Deputy Ministers of Health are all present, the World Health Organization representatives, the heads of health institutions and universities, members of alliances, people with epilepsy, all protocols observed. Thank you. It gives me great pleasure to be part of the second Epilepsy Alliance Africa Conference. With the theme Together We Will Defeat Epilepsy. Epilepsy is known but least understood. This has caused social problems that reduce the effects of medical care. These social problems, as a result of misunderstanding of epilepsy, have resulted in discrimination in employment, training, education, and even marriages, including planning and budgeting. Epilepsy is a common neurological disorder characterized by recurrent seizures due to abnormal synchronized neurological discharges. It is a medical and social condition characterized by recurring seizures. The condition is triggered by abnormal electrical activity in the brain, resulting in an involuntary change in body movement, function, sensation, awareness, and behavior. Epilepsy is one of the major brain disorders worldwide and should be considered a healthcare priority. The World Health Organization estimates 10 million people in Africa have epilepsy. 80% are not treated with readily available modern drugs. Epilepsy has no age, racial, geographic, or social economic boundaries. Both historically and cross-culturally, epilepsy has been represented as a stigma, and for many people with epilepsy, this has been represented as a stigma. For many people in Zimbabwe and most African countries with epilepsy, this is a continuing social reality. The legacy of the old myths about epilepsy lingers on, with the result that people with epilepsy are still subject to negative attitudes. The issue of stigmatization remains real and serious. Stigmatization leads to discrimination, and people with epilepsy experience prejudicial and discriminatory behavior in many spheres of life and across many cultures. They also experience limitation to their enjoyment of economic, social, and cultural rights. The stigmatization generates a hidden burden that discourages patients from seeking the diagnosis and care they need and deserve. Let me take this opportunity to highlight some of the work being done by our ministry. The Ministry of Health and Childcare, my Department of Epidemiology, Disease Control, and Mental Health Department has formed a task force that deals with people in Zimbabwe, with epilepsy in Zimbabwe, partnered with the World Health Organization, Zimbabwe League Against Epilepsy, and Epilepsy Support Foundation to advance and prioritizing epilepsy management in Zimbabwe in line with the World Health Assembly Resolution 6820, making epilepsy a priority in Africa. The government is committed to helping people with epilepsy to overcome the struggle against stigma and discrimination. The campaign seeks to reduce the treatment gap, which we estimate to be over 75%. However, medication has not been available in adequate quantity. We have also not been able to support World Health Centers with training in epilepsy management. We hope with more resources in future, we shall be able to do more epilepsy awareness to increase treatment and reduce the treatment gap. We therefore call upon the corporate sector, civil society, and related government departments to help us fight to reduce the treatment gap. Ladies and gentlemen, allow me to take this opportunity to thank the Epilepsy Alliance Africa for the work they are doing in supporting, promoting, and training health personnel on epilepsy. Finally, I encourage people with epilepsy to keep up fighting exclusion, stigma, and discrimination. My sincere hope from the deliberation and presentation of the second Epilepsy Alliance Africa conference will continue to advocate and educate not health professionals, but the public at large, as this is the new normal in light of the coronavirus. I thank you, Dr. Mugumbate. Thank you, everyone, for listening.